Hello everyone, this is Dr. Priyadarshini from Vardhan Hospital. So today let's talk about a common topic, that is infections in pregnancy. So the most common infection in pregnancy is urinary tract infection. Every 1 in 3 patients come with this infection during pregnancy. So why does it happen? Usually pregnancy there will be some hormonal changes, and also the blood flow to your kidneys, renal plasma flow, filtration rate will be increased. Usually there will be stasis in pregnancy, and as the uterus grows it may compress the bladder and have increased frequency of urination. How to differentiate between a physiological change which occurs and a pathological thing which results in urine infection? So there are some common symptoms which you have to be aware of, that is increased frequency of urination, and then any pain or discomfort during passing urination, any smell while passing urine, or a cloudy urine, any blood in the urine. Sometimes you can have fever or chills and nausea and vomiting also. So if you have these symptoms, please consult your gynecologist. We will do a urine routine. If you have pustules more than 5, we'll have to treat it. Sometimes we need to do a urine culture also and prescribe you the necessary antibiotics. So how to avoid these urine infections? Your gynecologist will advise you to do a urine routine every 3 months. See, there are 2 types of urine infections which can occur in pregnancy. Either you can be symptomatic, you can have any one of the symptoms which I told you above, or you can have something called as asymptomatic bacteriuria. It is, you will not have any symptoms, but if we do a urine routine or urine culture, there will be a significant amount of bacteria in the report. Both things have to be treated. Why? Because asymptomatic bacteriuria, for say, if it goes untreated, up to 35% of them may land in complications such as cystitis or pyelonephritis. A serious urinary tract infection may lead to low birth weight, premature birth, that is nothing but preterm delivery. So you have to be cautious. It can affect your baby also through preterm labor. It can affect you also. You can have infection leading to cystitis and pyelonephritis, and you may need to get admitted, IV antibiotics. It can go to that stage also. So please don't take urine infections lightly. There are so many patients questioning us, why before month I did a urinary test, there was no infection, why do I have to repeat? Yes, you have to do minimum every 3 months once. You have to screen for urinary tract infection. That is why either asymptomatic bacteriuria or infection, classic infection, both has to be treated in pregnancy. The second most common infection is yeast infection. That is nothing but fungal infection. So what are the symptoms you will have? You can have vaginal discharge, itching and excoriation of skin or swelling around the vulval area or in the vagina. You can have a smelly white discharge, or it can be of any other color also. Usually yeast infection, you will have a curdy white discharge. Most commonly you can have a candidiasis infection. People who are prone is, every pregnant woman is at a risk of yeast infection, especially if you are a diabetic. So if you have any of these symptoms, please visit your gynecologist. They may ask you to do a vaginal swab. They may do a speculum examination and give you some antifungals, because we don't give antifungals, oral antifungals in pregnancy. We will usually give a vaginal pessary or topical creams which are absolutely safe in pregnancies. Yeast infections can also lead to preterm labor, premature birth, and the infection you can have an ascending infection and it can affect your baby also. So what are the things which can prevent yeast infection? Take adequate amount of hydration, wear loose fitting clothes, wear only cotton undergarments, don't use nylon or polyester, and then don't use too much of all these V-wash and other chemical things. Keep it simple, soap, water, wash your private parts and keep it clean. It should be dry. Any place which is moist will have an infection. It's as simple as it. So please follow the following conditions. One more prevention which you can do is, you can take some prebiotic supplements also. So these 2 are the most common infections which we see every day to day in our hospital. So kindly, if you have any of these symptoms, don't take it light and please visit your doctor and get the necessary treatment. Thank you.